Hello, everyone. Welcome to our second Let's Talk COVID vaccines in the Black community. We might give it just a couple minutes. I see people are starting to join in right now, so we'll give it like a minute or so before we get started. Okay, I think we can go ahead and get started. So my name's Abduli Najai. I'm a third year medical student here at the University of Missouri School of Medicine, and I'll be one of your moderators.
I'm Verna LaBoy, health educator here at Columbia Boone County Public Health and Human Services, and I'll be your co-moderator. And I'd like to introduce this evening our panelists. First, Labia Butler, who is a senior LPN, and I'm really excited about Labia because I watched her grow up. You know, this is family meeting style, so she's a clinical charge nurse at Keene Family Medicine Clinic and was key in the operations at the vaccine clinic, the MaxVax clinic that we had at Faroe Field recently.
And I would like to introduce Malika Gallimore, communicable diseases public health nurse for Public Health and Human Services. She's currently doing her doctoral research on vaccine hesitancy. Um, Felicia and Ananobi is also one of our panelists. It looks like she's running a little late as well.
uh, Dr. Abudo, who we love all of our panelists, but she's our expert today with pediatric infectious disease being her specialty at MU Healthcare.
And then I'd like to introduce Debra Harris, who's a hairstylist and salon owner at Cut Above the Rest Barbershop and Salon. I've worked with her over the past couple months in addressing vaccine hesitancy, specifically in prominent areas in the Black community. So her salon and barbershops have been two places where we've been trying to facilitate conversations around the COVID vaccine and vaccine hesitancy in the Black community.
And I called you Dr. George Norman. Deacon George Norman, who is an icon in our community and deacon at Progressive Missionary Baptist Church, and really appreciate his efforts in our targeted vaccine clinic at Progressive last month. Thank you so much. I would like I would I would like to just really get everyone relaxed. This is like a family conversation, and we're having a family meeting, and folks have questions. Especially with all that's going on in the news surrounding certain vaccines. So we just want to keep it real. We promised at our first community forum that it would not be our last, and we're keeping good on our word, and we're back. And we're back with more questions, and hopefully we'll get some answers and address your concerns and hesitancy issues and move our community forward. So let's talk.
Right now, there's a lot of information going on around the vaccine. So we just want to give you all some updates on currently where we're standing here in the community. So right now, everyone is eligible to get vaccinated. The vaccines are free for everyone. You don't have to have health insurance. And basically everyone is eligible. We know that Ramadan is right now, so we thought it'd be important to also say that the vaccine is halal. And this does not interfere with fasting. It shouldn't break your fast if you take the vaccine. There are no stem cells are used for Pfizer or Moderna vaccines as well. And towards the end, we'll actually have a couple sites that will be going on in the community in the coming week. That will be places where you can go ahead and get vaccinated if you need to. So I would say that right now we know there's a lot of questions and concerns and information going around about the vaccine. So our focus really wants to be just taking the time to really answer any new questions that people have. We know a lot of people are concerned about Johnson and Johnson with the current pause on it right now. I know people are hearing about blood clots that is causing, and there's lots of other information about like side effects you can get from the COVID vaccine. What is a side effect versus what isn't a side effect, and should I go to my doctor if I feel this way after having the vaccine? So we really want to take the time, and we're thankful we have such a great panel that will hopefully be able to answer and address a lot of the questions and concerns that you have. So I think right now I would like to go ahead and just open the floor to our panelists and let you all please submit any questions that you have. So if I got the Johnson & Johnson vaccine, should I be worried?
That's a great question. And I think that we have to first understand what's going on about it. And this to me is a proof that the system we have in place to monitor safety of vaccines actually works. So this is actually a success story in my mind, because out of the more than 15 million vaccines that they've given, they found 8 people who had clots around the brain, which is what the concern is. And so in that light, because these are very serious concerns that are associated with the vaccine, we don't know that the vaccine causes it, but it's been in relationship with somebody having the vaccine within a certain time frame. There's a pause right now for the FDA and the scientists to look at the data overall and determine whether or not the vaccine is likely to have caused it, and if it's a concern enough that we need to just take that vaccine out of the market. And this has been done and applied to other vaccines before. And so this is exactly the way that the system is designed to work. And so for me, it boosts my confidence even more in that we are continuing to monitor the safety of the vaccines, even outside of the trials, even after they come out and more people have access to them. I would say that with the Johnson & Johnson vaccine and the blood clots that are being described, they tend to happen within 3 weeks of somebody having the vaccine. So the recommendation right now is if you've had the vaccine more than 3 weeks ago, you probably do not have anything to worry about. If you've had the vaccine in the last 3 weeks, you probably still don't have anything to worry about. However, you have to watch yourself closely for any symptoms like headaches or blurry vision or anything that could indicate that you're having symptoms of stroke or a blood clot. And if you have any concern, any such concern, then you would reach out to your primary care provider who can then guide you into the next steps. But again, keep in mind that this is 6 or 8 cases out of millions of doses. So the chances of that happening is very low.
Thank you, Dr. Abudo.
Have there been clotting issues reported with Pfizer or Moderna?
No, there have not been any clotting issues related to the Pfizer and Moderna. And the reason is that, or we think that these vaccines are they're made differently. So the Pfizer and Moderna are the mRNA vaccines. And I think we talked a little bit about that last time. The Johnson & Johnson it's made differently. They use a vector, they use a viral vector to deliver the vaccine. And so it is a little similar to you. Some of you may have heard about the AstraZeneca a vaccine that is coming from the UK, that they also had issues with blood clots in their vaccine trial as well. And we know that these two vaccines are made in a very similar way. And so the thought is that maybe it has something to do with the way that these vaccines are manufactured, which is again another reason why there was a pause, that we now have two vaccines that are made similarly that have sort of similar setup in terms of these events that we're seeing. But the events are still very, very low in numbers compared to how many people are vaccinated. But those are the only ones that I know, and they're very similar in the way that they're manufactured.
Thank you, Dr. Abudo. Debra, I first of all am honored that you've joined the panel tonight. Could you unmute yourself? You're a business owner, and I think Abduli, if you would share your relationship, your unique relationship with the Harrises and A Cut Above salon and barbershop.
Yeah, so I can say coming to Mizzou as a first-year medical student, as a Black first-year medical student, one of the first questions I asked was, where can I get my hair cut? So speaking to the Office of Diversity here at Mizzou, they kind of recommended A Cut Above. So I've been getting my haircut there since my first year of medical school. So I would say even prior to the pandemic, me and Debra sat down and kind of talked about, I was like, I feel like as a Black medical student, um, I feel obligated at times to do what I can to get into the community and kind of increase outreach. So me and Debra kind of sat down and had a conversation about like the barbershop is like a hub in the community. There's tons of people here. And I feel like it could be a unique space that we could use to kind of deliver information about healthcare. So then me and Debra actually planned on like having like community like conversations in the barbershop focused on like preventative health and cancer screenings, planning like blood pressure and blood sugar checks even before the pandemic. So then when the pandemic occurred, things kind of slowed down for us. So once the shop opened back up, um, one of the things I started to notice that like a lot of conversations in the shop were centered around the COVID vaccine and then COVID. So I actually spoke with Debra again and then my barber Rufus, who I've been speaking with, and we actually got together and wrote like a short survey that I was able to distribute at the barbershop that basically asked three main questions. What are your thoughts on the COVID vaccine? Do you plan on getting it? If not, why? And if we hosted a short community conversation, what questions would you have for the panelists? So I ended up doing that at a cut above. We had about 40 responses. It was great. And I was able to take those survey results, bring them over to Nikki, and then Nikki was the one who connected me with the work that you all are doing here at the health department. So yeah, so that's kind of how we got started. So even right now, I'm currently working with Debra. We plan on planning a community event this spring that'll focus more on like healthcare, preventative health. And we hopefully with people being more vaccinated, we want it to be something we maybe do outdoors and just invite community members to come in and discuss. But yeah, Debra's been awesome in the community and it's been very helpful to me. And like we've been working closely together to address just like increasing access and just information regarding healthcare in the Black community.
Yeah, that's pretty much how it went. And I thought it was so great having conversations with him about different health issues that we might be having, especially we talked a little bit about prostate and then the issue with COVID coming up and just trying to be able to reach as many people as possible and give them information. And with myself as well, you know, trying to decide what was going to be the best decision for me and getting that information was great. Yeah.
Debra, do you think you could talk a little bit about your thoughts initially when you heard about the COVID vaccine and kind of what led you to getting vaccinated?
Well, when I first heard about it, I wasn't really for it. Looking back at the history of things and how things had done happen, and thinking about the time frame that it was kind of put together, made me very hesitant. But then after we got new leadership and different conversations came about, more information kind of came out, I kind of just weighed my options. I'm in an industry where I am around people all the time. And a lot of times I'm in people's personal space. And so for my husband and myself, both being in the household together, we just kind of thought about it. We prayed about it. And, you know, it was really amazing to me. The next day is when I kind of heard about that they were going to be given the vaccination in the community, because I had been reaching out, doing the survey online, possibly getting a shot, and it just wasn't coming through. But then when the opportunity came up for getting in at Progressive, I just took it as a sign, yeah, move forward, go ahead and get it done. And then thinking about the options of we're all gonna leave sooner than later. So why not be sensible about preserving your life as much as possible? So those were just some of my thoughts, you know, thinking about it moving forward. I also use my platform with my clients, having a conversation with them, getting their thoughts. A lot of people that I'm around, they're just they're just like on the fence. They're not moving past go on it. Like, and when I ask the question, well, why? They don't really have a good answer. But a lot of my clients have gotten shots. A lot of them that are in, you know, different occupations and stuff, and they again weighed out the options of, should they or should they not, and most of them have. Some of them have not.
Thank you, Deborah. There used to be more people wanting the vaccine than appointments. And this is for the panel. Man, for a while there, it was rough for people to even get the vaccine. They were signed up everywhere and couldn't get a call. But now there seems to be more vaccine than people. Why do you think that is?
I think two things are happening at the same time. One was that everyone who was super ready and anxious and already knew they wanted to get the vaccine, they've been able to get it. And at the same time, we've been ramping up the amount of vaccine that has been available in the community. So the supply is now outweigh the demand, but we've also now just opened it up last week so that everyone over the age of 16 can get the vaccine. So I kind of see that leveling out a little. I don't see us going back to pre-times when it was hard to find the vaccine. So I think it's only good news now that there's enough vaccine that if you want it, you should be able to get it right away.
So I have a question. Is it open to all people now, children, everyone? Is it open for everyone right now?
So not yet. One of the vaccine, the Pfizer vaccine, is approved for 16 years and up. That is the only one currently that some children can get. They were done doing the trial or the research on the children that are between the ages of 12 and 16. And so currently both the Pfizer Moderna are going through the FDA to get approval to start vaccinating that younger age group. And so once they get approval, what I've heard is that hopefully by the summertime, we'll have the younger children getting vaccinated. And right now, they're also enrolling in the clinical studies, the younger children, so between 6 months and 12 years of age. And the reason for that is that because children are smaller in their body size, we want to make sure that the dose that they give them is a dose that's going to be safe, that they're not going to have a lot of side effects, because we already know the vaccine works. But for children, it is more of a question of finding the right dose that limits the side effects, but also gives them enough protection in the long run.
Okay.
So our next question is, so cases are starting to drop in Boone County, and there aren't as many active COVID cases here in Columbia. So do I really need to get vaccinated, especially if I'm a healthy person anyways? And could you maybe touch on the importance of getting vaccinated and I know a lot of people throw the term herd immunity around, and some people don't know what that means. So can you kind of touch on what that means actually?
Yeah, I can talk a little bit about that. I think Malika can add on to what I have to say. Absolutely, you need to get vaccinated. I think of it a little bit like the flu shot, although it's completely different viruses, different diseases. So don't necessarily go head to head with me here, but just the correlation with the vaccine, right? That sometimes I do things to protect not just myself, but the people around me. And so the same thing with the COVID-19 vaccine is that it's not only protection for me, but it's protection for the people that I love, that are around me, that for whatever reason may not be able to get the vaccine. Right now, it's children that cannot get the vaccine, or people who have, a reaction to one of the existing vaccines. And so it serves both in terms of protecting me, but also protecting them, that I'm not going to pass on the virus to them. And we now have enough evidence to say that, yes, the vaccine, not only does it help you not get very sick if you do get exposed, but it also helps in terms of your ability to actually pass that virus on to someone else. And with that, we also think about the variants, that the more the virus sort of multiplies itself, the more it changes, because it's an unstable virus, and the more we're going to have issues with variants. And so the more people we can get vaccinated to really slow down or eliminate the spread of the virus, the better it's going to be overall. And so the idea of herd immunity really depends on the disease that you're talking about, how contagious it is, and what sort of damage it can do. So for things like measles, for example, there is a really high number that we have to get at because it's highly, highly contagious. So for COVID, people have estimated about 70 to 80%. So that's why you get estimate, because we don't know for sure. For certain population, it may be a little different, but this is an estimation of how many people need to have protection. So the few of us that are not vaccinated can be protected and not get the infection. So that's where that number comes into play. But we each have to do our part. So if we say that 75% of us need the vaccine and half of the people on this panel decide not to, right, then we won't get that herd immunity, right? And so it's still important that everybody who can get the vaccine considers getting it to protect themselves and also to protect the community.
So I have a question in reference to people that are bedridden or elderly people that are not able to get to the facilities to get the vaccination. Is there something in place that that would be accessible to them? Or are they going into the home to do them at this point? Or do you think that that would be something that may help? Because I'm sure there's people that are elderly or unable to get to these locations that would like the opportunity to have these vaccinations.
Absolutely. The health department has a program for anyone who's homebound or can't leave their home because of sickness or whatever. They just need to call the local health department. At the end of this presentation, we'll have a slide with that phone number. And they will get an appointment scheduled, and someone from the health department will come into their home and give them the vaccine.
Oh, great. Great.
And I wanted to touch a little bit on should I get the vaccine since there's so few cases now. I feel like in total, we have to kind of think about the big picture as well. We've had maybe 18,000 or 19,000 cases that we know about. Even if that's double, that's 40,000 cases in Colombia, and the population is like 100,000. So that still leaves, 60, 70% of the population that would be vulnerable to COVID if they didn't get it vaccinated. So for that reason, it is still very important to get vaccinated to protect yourself, and also, like Dr. Albudo said, people get infected or for new variants. I would hate to be the person who developed a new variant because
on mute or something, but
I'm having trouble deciding about whether or not to get vaccinated.
Thank you. And I just want to take a second to welcome one of our other panelists, Felicia Ananobi, who's assistant professor of nursing at Stevens College and is president of the Mid-Missouri Black Nurses Association. So thanks for joining us.
Thank you so much. I apologize for being here late. I was at a conference that just ended. Thank you.
Yeah, no problem at all. So we're just doing the question and answer session, so feel free to chime in.
Okay.
So our next question is, what is the protocol for someone outside of the United States who would like to get vaccinated?
The good news is that a lot of countries are getting the vaccine through the WHO. There's a program that is set in place. Different countries can ask for certain allocations of vaccines, and the vaccines are delivered to them through the World Health Organization. And as a matter of fact, multiple countries have already gotten vaccines and started the vaccination process. And so they may have access to different vaccines than we do in the US, but there is a global attempt at making it equitable so that everybody has a chance and has access to the vaccines.
The next question is, do I need to get the vaccine if I've already had COVID?
Can I take that? The answer is yes, because we have flu and we still get the flu vaccine. So this virus is a new virus. And even though you've had the COVID vaccine, it's very important that you still get the vaccine, because the vaccine will give you a lasting immunity. And there's no question about whether we have fully understood the implications of this new virus and the protection that is given through either the infection or through the vaccine. The infection itself, the lasting effects of that on patients has been documented. That is really, people are dealing with a lot of residual symptoms following the infection. So to be on a safe side, the best and the safest thing for everyone to do is to get the vaccine, whether they have had the COVID infection or not. Thank you.
Thank you. Labia, so I actually wanted to ask you, so I got my vaccination at Faroe Field and the process was seamless. So it was awesome to go through. So I just want to know if you could kind of touch on like the behind the scenes and like what setting it up was like, and maybe some barriers or challenges you faced doing that.
Oh yes, I must agree that Faroe Field vaccine clinic is a very smooth running machine. And a lot of the prep work was done behind the scenes, and we took the information that we learned from our flu drive-through clinic and kind of put it all together. We had a team called the Brain Trust team with nurses and pharmacy and physicians and IT, just a whole slew of us just putting our heads together to figure out the best workflow. We did a few trial runs through our grill for employees, and that worked very well. So that helped us open it up to the community. Our hardest thing was finding a location, but we were blessed enough to find the perfect location that's big enough to house all of the workers and the patients. And working there, I mean, that environment is amazing. The nurses and the patients are just so grateful and thankful to be there. I mean, I tell you, some patients have brought us nurses to tears just telling us how we've saved their lives by giving them the vaccine. And then some nurses have expressed just how grateful they are to be a part of the solution to the COVID pandemic.
That's incredible. Thank you so much for all the work you've done.
Our next question is, will the vaccines protect me against the new strains?
That's a bit of a loaded question. I mean, a complex question. Yes, to some degree. So we know that it has good protection still against the UK variant. I think the troublesome variants that we are having issues with right now are the South African variant and the Brazil variants. And so both Moderna and Pfizer, and I know other companies are looking into developing new strategies, either having a booster vaccine that will get or changing the way that they make the vaccine so that they'll have more added protection to those specific viruses. But keep in mind that the way that they tested for whether the vaccine will work is in the lab, and our bodies do not function like the lab. And so for me, we have, our bodies are smart enough, our immune system is smart enough to know what to do. And so I do believe that the vaccines that we currently have does allow us to protect our bodies against most variants, not all of them, but against most variant, because its immune system can adapt and change and know what to do. But when you get into a situation where there is a variant that is completely different from the original one, then that's when we can run into issues. And that's what happens with the flu viruses, that every couple of years we have to change the way that the vaccines are made, because the virus changes enough that it becomes completely different from what we were protecting against initially. But so far with this virus, we haven't seen that drastic of a change yet to warrant any major changes in what's going on. And I think Felicia had something to add too.
Yes, I was going to say that even if it doesn't protect us from the new strains, there's documented evidence that it will protect you against serious illnesses and against death. So at least it prevents someone from dying and also from having serious residual complications that may arise if you don't have the vaccine at all. So it is in our best interest to get vaccinated. And we're saying this not to impose our ideas or values on anyone, but to give you the information that you will need to make an informed decision, because ultimately the decision is yours.
Thank you. So one question that I've heard in the community is, so some people say they have side effects after they get a vaccine. Some people say they don't. So one question I've heard is, if I don't have side effects after getting my vaccination, does that mean it's not working as well for me?
No, that's not what that means. I'm not really sure, why some people have those side effects from the vaccine or not. I personally never had any issues with it. I had the Pfizer vaccine and I had both doses and I felt fine, just a little bit of a sore arm. But I can tell you the rest of my family did have some symptoms after their second dose. Either way, I'm confident that I am protected. I'm confident that the vaccine worked. There are plenty of other vaccines that you get and you don't ever have any side effects, but that doesn't say that that vaccine wasn't effective for you. For example, you can get Tdap vaccine and the most that you'll get is a sore arm and you don't have any symptoms of tetanus or pertussis, but we know that it works. So I kind of using that same logic for those who don't have any symptoms after any of the doses.
The next question we have, what should I do if I don't have a primary care physician and have health issues? There is some fear about what the vaccine could do to me.
Well, I was hoping Labia or someone else who runs the vaccine.
Well, I was going to say, if you do not have a primary care physician, just reach out to MU Healthcare, one of our family medicine clinics, and we will be glad to take you as a patient and help educate you and protect you from this virus. And if you have health issues, you definitely need a primary care physician.
You know, we also have the Family Health Center. It's called Compass Health now. And to me, that's like the best kept secret in town. No one in our community should be without a primary care physician. We have resources that people are just not taking advantage of. You know, if you have Medicare, Medicaid, it's fine. They even will use a sliding fee scale. So if you have a health condition and no primary care physician, that's almost suicidal, because it's in this environment, you should be under proper care.
And to add to that, all the healthcare departments and community health centers, they have providers that can take on anyone with or without insurance. And like Verna said, there's a sliding fee scale that they use. If you are not working or if you don't have any income, you will be taken care of regardless. So it is your duty to take good care of yourself and to be able to find a provider that you trust, that you can communicate with, that you build a relationship with over time. It doesn't just start in one day. I am a family nurse practitioner, and building up relationship with patients is one thing that providers value. But the problem with so many people is that sometimes they go from one person to another and they will not stay on with one person to be able to establish good relationship and um, good rapport with that provider. So that is what is needed for you to be able to take good care of your health issues if you have them. Thank you.
I agree. Continuity of care is very important. Just sticking with the same provider so they can get to know you, get to know your health concerns, and get you taken care of.
So our next question is, what kind of vaccine side effects should I worry about? And typically, how long should side effects from the vaccine last? And what point should I go see a doctor?
Okay, heck, I'll take that. Um, the side effects that people experience is different between everybody. There's no one, there's no man, not many people that have exactly the same reaction or symptoms or side effects. So you know your body, but there are serious side effects that when they happen, you must call your healthcare provider. Something like severe headache, the worst headache of your life, or the worst headache that you've never had, or headache that is lasting beyond 24 hours after you've taken either Tylenol, Aleve, or Motrin, and you still have the headache. If you have temperature for over 109.9, you need to call your healthcare provider. If you have shortness of breath, that is a serious sign. Or if you feel like you are having trouble swallowing, shortness of breath, difficulty swallowing, or feeling like your tongue is swollen are very serious side effects that if you have them, you go straight to the emergency room. And especially for people who have history of anaphylactic shocks and people who carry EpiPen, when they get to the vaccine clinic, they need to let the nurses, the people who give them the vaccine, know that they have history of anaphylactic shocks, so that instead of having you wait for only 15 minutes, they will have you wait for at least 30 minutes to be able to make sure that you are safe and that you don't have those serious life-threatening reactions that you could have that may be very fatal. So some people have soreness of arm, some people have fever, some people have chills, some people have fatigue. All these vary in severity, but whenever you have any side effects that you are concerned about, the best thing is to call your physician. Don't even wait. And if you have leg pains or any signs of anything that is unusual before that you've never experienced before you had the vaccine, then you definitely need to call your healthcare provider. Thank you.
I just want to add that these serious side effects are very, very, very uncommon, right? Like we talked about the blood clots earlier. To me, it's like the laundry list of possible side effects that they give you on medications. I don't know how many of you watch commercials on TV. Every time I hear a commercial, I'm like, why would anybody want to take that drug, right? But they have to tell you all those things because even though they're rare, they can happen and they're serious. But the majority of people do not experience that degree of side effects of those that severity. For most people, it is soreness at the site of the injection. It is a mild headache, mild, muscle pain that go away within a day or two. And in general, people say that they have those side effects more so with the second dose if they're getting the mRNA vaccines compared to the first time they get the vaccine. So even though these things are things that we have to talk about, they're very, very rare. And most, just like any other vaccines, it's pain at the site, some muscle aches, some fevers, headaches that go away within a day or two.
Okay, I just want to add something and a disclaimer for to follow up on that. Um, as a healthcare provider, I know the fear. I hear you. I know that there's fear out there. And even though they are rare, some people have experienced them. And I would say that I did. I carry EpiPen. I have history of anaphylactic shock. That's the disclaimer that I want to share, because it is not enough to tell people, oh, those things are so rare that you may not. I have experienced it, and I would be a hypocrite to not share that with you people listening, the audience. So the reason why I want to share this is that it is important to be upfront and honest, to have all the information that you need. Since I experienced that, I feel obligated to share that because of my history. I have history of anaphylactic shock. I carry EpiPen. I'm a healthcare provider. I know the signs, the warning signs. I took antihistamine 30 minutes before I went. I would have been surprised if I didn't have the reaction. It was my first shot. I had the reaction. It was severe, and I will not be taking this. I was advised not to take the second dose. So those things happen, but they are very rare. That was why specifically I mentioned earlier, if you carry EpiPen and if you have history of allergic reaction or anaphylactic shock, make sure you let the people in the clinic know about that history so that they will take better care of you, so that nothing will happen to you. So thank you.
And to piggyback on that, as a nurse who gives shots, also, if you have a history of passing out, please tell the nurse. We would like to know that before you pass out. We want to keep you flat, let you lay down and relax and take care of you so there is no incident. So same with that EpiPen thing. If you do carry an EpiPen, it is very important to let the nurses know, because we want to take good care of you. And if you give us all that information, we're going to be on top of our game, looking out for you.
I know Mr. George Norman has had technical difficulties, but I will tell you, when I heard that he had gotten sick with COVID this summer, I made sure that I checked on this local treasure a few times just to check on him and see how he was doing. And when we started the vaccine clinics, I mean, he stepped up and brought his church with him. And I can't say enough about how much I appreciate Mr. George Norman and Progressive Missionary Baptist Church. And I don't know if he's able to get online. It doesn't look like it, to share, some of the long haulers, those that are still dealing with some of the after effects, the residual effects from encountering COVID. So it might be a good time for you, Dr. Abudo, to talk about the long-term effects of COVID and what you've seen.
Berta, can you hear me?
Yes, Mr. Norman,
okay.
We hear you.
All right. Well, I'll be more than happy to share my experiences as well. And I thank you for those kind words. It appeared to me that when we started, I guess, getting back to normal after I got out of the hospital, then my whole focus was on when that vaccine became available, we would take it and we would go and tell everybody else that they need to take it, because nobody needs to experience what COVID will do to you with 4 weeks in the hospital. Medication, every time you turn around, you were hooked up to something, or chest x-rays or echocardiograms. It's not a nice feeling to be helpless. And my drive was just to make sure that everybody that I knew would be able to get that vaccine if they wanted it. And that was the driving force behind me. And I also understand that most Black men don't have primary physicians, and they don't like going to the hospitals or clinics. And so my target was really to target the Black men. Excuse me. But we wind up with the Boone County Health Clinic through Miss Verna, and getting that vaccine set up. And that worked just as well, because I saw an awful lot of Black men come through there.
Yes.
So, and the residuals on that, for me, I already had asthma and COPD. And so it affects my lungs. And that's the hardest thing that's going on with me. I can't hardly do a lot of things. Like walking around the house, I'm exhausted when I make it back. Most people would just have a second wind and ready to go, but not me. So it's something that you live with, and I don't know how long I'll be like this, but God is good.
We have about 10 minutes left, and it's really time to wrap it up. I would like to give the panelists an opportunity to share any last thoughts or any closing comments at this time with our audience. And this is recorded, so we'll be able to share the link. Dr. Abudo, is there a closing message you have for our Black community, and with relation to hesitancy or any reservations about being vaccinated at this time?
Yeah, absolutely. Thank you so much for giving me the opportunity to talk about this. So in my mind, and this is the way that I explain vaccines to my children, I tell them it's like a shield. It's a shield that protects you. It's better than having battle scars, because battle scars take a long time to heal, can take a long time to heal, and can be deadly, rather than having a shield that protects you when you go to war. You already know what to do and you have the right equipment. It's the same thing here, that when you get the infection itself, you have, if you make it out well without getting into the hospital, we know many people who end up having heart conditions because of the virus, because it causes inflammation of your heart. It causes inflammation in your lungs. It can cause inflammation in your kidneys. And so a lot of people have residual or long-term effects that are very serious, like heart disease and lung disease, like George was talking about earlier. But even those who don't have that, we have a lot of people who say that they just have this brain fog. It can also cause inflammation around your brain. And not only does it affect adults that way, it also does the same thing with children, where it takes them months to recover, that they feel tired all the time. They feel like the brain is not up to par. They're not as sharp as they used to be before they got the infection. And there's a true concern that some of them will go on and have clots. We've had several people who suddenly died, even though they had recovered, because of the inflammation around the heart and around the lungs, that over time overworked the muscle, the heart muscle, to the point where it just gave up and gave in. And these were healthy, previously healthy young people who were athletic, who ate right, and who did everything right. And the only thing that changed was that infection. So again, my closing comment is, despite everything you hear in the news, talk to a provider, talk to someone about the vaccines, and get the real facts behind it to really decide for yourself whether or not the risk of the vaccine is better than the risks that you take exposing yourself to this new virus that we're still learning what it does and how it behaves.
And speaking of kids, I will just mention that my 17-year-old has been vaccinated with Pfizer, and she did great.
So thanks again, everyone, for this amazing panel. I can say I even learned a lot today. So just before we close, just a few updates. So we do have a couple upcoming vaccine clinics. So we have one on April 16th and 17th at Faroe Field. Another one on April 19th and 20th at Columbia Mall, and then one on April 24th at Indian Hills Park. So before we close, we would like to do an exit survey. So if you all could take a moment just to answer the question, do you want to get vaccinated? Perfect. So it looks like all of our answers are I already have or I plan to, which I think is really reassuring to hear. And I think, kind of like our panelists touched on, our goal today was just to answer as many questions and ease any concern that people had. But I mean, at the end of the day, I think our plan is really just to give the community the information they need to make an informed decision going forward. I think all of us would like as many people to get vaccinated as possible, but at the end of the day, choice is yours, and we just want you all to have the right facts. There's a lot of information going around, and make sure you have the right information to make an informed decision. So I think that is all that we have tonight. So I think we would also like to emphasize that going forward, this won't be our last community conversation. We definitely plan to continue this going forward. I know me and Debra are currently working on something early in the summer that will serve as an upcoming community event that will focus on healthcare in the Black community. So we'll get more information on that moving forward. And if you have any questions, please send them to covidvaccine@como.gov. or call 573-874-CITY. Thank you so much. Ms. Vernon, do you have anything you'd like to add?
Again, I appreciate all the panelists. And I too learned a few things, even though I work in public health. Just having all of the questions come forward at the same time like this was amazing. So thank you again, panel. Thank you, community, for joining us, and let's move forward.
Thank you, everyone.